Many states across the U.S. are letting go of masks as more people get vaccinated. Starting today, New Yorkers can take off their masks, both inside and out, in most circumstances, but individual businesses can continue to require mask wearing. Most businesses are also able to return to 100% capacity today if they can keep 6 feet of social distancing. Governor Andrew Cuomo said the changes come after a hellish year, but says, quote, "We are looking at a different tomorrow." And in Texas, Governor Greg Abbott has issued an executive order banning government entities in the state from requiring masks beginning Friday. That includes public schools, which must end mask mandates after June 4th. There are some exemptions from the order, such as state-supported living centers and government-owned or operated hospitals. The mask easing comes after the CDC relaxed guidelines last week. The agency says fully vaccinated Americans can stop wearing masks in most settings. However, there's no clear way to distinguish vaccinated from unvaccinated people. For more on this, I want to bring in Dr. Eric Feigl-Ding. He is an epidemiologist and health economist, as well as a senior fellow at the Federation of American Scientists. Doctor, welcome. We're so glad to have you with us. So you say you're not so pleased with the CDC's guidance to drop masks. You and a group of doctors believe it could actually cause cases to spike. Tell us why you think the CDC is off base here.
Thank you for having me. Well, I think CDC has made a grave mistake here because we know that less than even half of Americans are fully vaccinated. We know children under 12 are not even eligible, and we know many people like immunocompromised are not able to mount a sufficient defense, even with vaccines. They have to rely on the natural herd immunity if most of us are vaccinated. But the problem is right now, the virus will keep spreading, and many people will not be very honest about their vaccine status. And there's no way for everyday Americans or even companies to verify. So if you go to a grocery store and you see someone not wearing a mask, you don't know, are they not wearing a mask because they're vaccinated or because they're anti-mask or anti-vax or vaccine resistant. And that is inherently the problem. There's just too many of us vulnerable, and the virus spreads much more quicker than before and potentially more susceptible to children. So we have to be extra vigilant. And with less than half the population vaccinated, that is just not enough, and it's not safe to take off the mask.
And so where do you think the greatest risk now lies? Is it for people indoors with large groups of unmasked people? And how long would you like to see the mask guidance continue?
That's correct. Indoors is my greatest concern. Outdoor without masks, unless it's super packed, like a rock concert, I think outdoors is relatively safe. It's indoors without masks that is the biggest concern, because this is an airborne aerosol virus. And you heard Governor Cuomo say indoors, 6 feet is okay. It is not okay. Airborne virus means it will go long distance beyond 6 feet. It will go around turns and curve around corners. The virus builds up these aerosols indoors wherever people congregate. And that includes places like shopping stores and grocery stores and all these different indoor risky environments. And I'm afraid there's too many children, especially like schools, where there's just not enough vaccinated population. And even if you're vaccinated, you could carry the virus to someone in your home who's not vaccinated, who is vulnerable. And that is inherently the problem. The vaccine protects you from severe disease, but doesn't protect you 100% from carrying it to someone else. And we saw that in the New York Yankees fully vaccinated team as well.
Right. Yeah. Well, that was a very sort of spooky situation there. But I thought the CDC said that the science was showing them that if you are vaccinated, you are very unlikely to pass on the virus.
The key word is less likely. Less likely does not mean 100%. And I want to emphasize that the mRNA vaccines and the Johnson & Johnson vaccines have very different efficacies. Johnson & Johnson vaccine has a symptomatic efficacy of around 60s to 70s. And that is not, yes, it's less likely, but that is not foolproof in any way. And, the Yankees was Johnson & Johnson vaccinated. And so this is what I'm emphasizing. For those who are of high-risk population, high-risk children, a vulnerable population, immunocompromised family members at home, they still cannot take the sufficient risk. And children under 12 are not vaccinated either. And so that is inherently the problem, that less likely does not mean foolproof. And one thing we know from this virus, it will penetrate and it will be contagious through very different means, and it's very aggressive. And the new strain from India, B1617 subtypes, they are potentially 2 to 2.5 times more contagious than the original strain. This is why we have to be really vigilant.
That's definitely scary to hear. Doctor, what about businesses? How do you suggest that they navigate this, especially with some still imposing those mandates while others are dropping them? Obviously we can't have a uniform mandate anymore. We've gone past that, but how would you recommend that businesses navigate this?
Yeah, this is very tricky because CDC leadership has kind of set the bar, and this bar is unfortunately very leaky and risky. I would recommend maintaining indoor mask mandate, improving ventilation, and if you're unable to directly improve ventilation, install things like HEPA filters and UV that can help disinfect the air, because ventilation, disinfection, and masks are the other ways of dealing with an airborne virus. If vaccination and masks themselves are not sufficient to stop the virus, you need a multi-pronged strategy. And with less people wearing masks, and obviously the difficulty enforcement, you have to add these other strategies. And personally, I think the federal government and businesses should demand for either a vaccine passport or an e-verify system that can verify people whether they have been vaccinated or not, such as cruise ships, high-risk businesses like that, where people really need to be honest or be verified they have been vaccinated. Yeah,
that would make everybody feel better. All right, well, Dr. Eric Feigl-Ding, thank you so much for sharing your insight with us. We really appreciate it.